Hello again, Bettina. I'm Dr. Ruth Roberts, your pet's ally. Hope that you are all well. And today we're going to start off with a question that is, I won't say near and dear to my heart, but one that's been plaguing the hell out of me for the last several weeks. And the question's from Kay Griffin, and she enjoyed the presentation I did on the summit for Animal Wellness Summit for SIBO. And Kay, I think I'm so sorry I cannot remember your pup's name, but we talked about her 14-year-old Westie with SIBO, and he's been on Tylosin twice a day for a year, and lately things have kind of started ramping up as far as GI sounds and licking at night. And he's eating half freeze-dried turkey from Primal and half crock pet with chicken and veggies on the safe list, and a few supplements. So any suggestions on how to help him have a better night? And Kay, interestingly, I started having some pretty massive problems and started losing foods that I was able to tolerate for no clear reason. I had an episode of food poisoning or traveler's diarrhea in December, and that really kicked the symptoms up into high gear. And a week ago, I had to restart Xifaxan, which is what gets used on the human side, for the second round. And I'm thinking to myself, what in the heck is going on here? This just doesn't make sense. This is not the way that SIBO is supposed to go. So I have a couple of suggestions for you. There is a lot of new evidence on the human side, and unfortunately not much on the veterinary side, because we still really don't understand it very well. And so this is my attempt to draw some parallels between what's been working for humans and bring them into what we might be able to do to help our dogs better. And so I'm going to tell you this as all completely experimental, and I think this will work, but you're going to have to help me figure this out. So one of the things that I found is something called the Ileocecal valve maneuver. And what I want to do is kind of explain what that means in terms of both human medicine and then how that might translate to veterinary medicine. So if we look up ileocecal valve syndrome, on the human side, again, this is literally there's a valve that goes between the ileum, which is the last part of the small intestine, and the cecum, which is the first part of the large intestine, and the appendix is sort of stuck in there as well. So the idea is this: when the valve is open and fails to close, then material comes from the colon up into from the large intestine up into the small intestine, which can make those bacterial counts go sky high. And there we are, here's SIBO, because we now have small intestinal bacterial overgrowth. The other way this can happen is that the valve is closed and fails to open. So things build up in the small intestine. It can't descend down into the large intestine. So again, the small intestinal bacterial overgrowth, because these guys have nowhere to go, even if the migrating motor complex is working. And so from that presentation, you'll remember that one of the theories of SIBO, how it happens is that when you have food poisoning, your body develops antibodies to the enterotoxins, which happen to be very close in structure to a protein called vinculin in the cells of Cajal. So when that happens, then the migrating motor complex no longer works, because this is essentially the innervation of the migrating motor complex that tells it to do its thing. Hey Susan, good to see you. All right, so this is interesting. So I'm thinking to myself, okay, how do you do it? And, for years, I was doing a version of this ileocecal valve maneuver. And this is Dr. Nirala Jacobi, and I'm going to put this, I'll just put these links in for you too, who is the SIBO doctor. And when I first started having difficulty with SIBO, I learned a lot. The ileocecal valve is a couple of inches towards the belly button from there. And indeed, if you have gas that just isn't working, just, it's not moving, things of this nature, it is a way to kind of help get things going. And so this idea is sort of forming in my head, so I'm going to just throw some of this out here, which may or may not make sense. So if we are in a chronic state of panic, our innervation gets messed up, and specifically the sympathetic and parasympathetic network get meant for it to kick in and drop the counts down. I was able to do this maneuver and provide substantial relief for myself. So I'm thinking, okay, how do we translate that to dogs? And this is where it gets a little difficult. So let's pop over to a couple of pictures here. Let's see, and let me drop this in there so you can kind of look at what ileocecal valve syndrome is. And then I'll drop this in here as well, so you can take a look at that too. But basically, here we go. This is, in dogs, we don't have the appendix, we have the cecum instead, which is a much larger version of the appendix. And the appendix in humans is considered to be a vestigial organ of the cecum. In horses, this is an enormous organ because this is where they do their fermentation. For cows, it's in the rumen, for ungulates, basically. But it's still the same concept and the same structures. So this is the ascending colon. So here's the last part of the ileum, the small intestine coming up. Here is this muscular sphincter. So again, we've got a sphincter issue similar to gastroesophageal reflux disease. And then here is this opening to the cecum. So from the small intestine into the large intestine, and then some of this material can go into the cecum and do what we're not quite sure, to be honest. So, and then here is this picture kind of in a side view. Here's the small intestine coming up, and then the cecum, and then the large intestine. So it's kind of part of this gateway kind of coming in there. So it makes sense that things could kind of get stuck and create some problems. And in fact, even though this is not a complete valve in between cecum and ileum, it does provide some structure there. And let's see, make sure I'm not actually telling you the wrong thing. Yeah, that is the cecum coming here, so small intestine, large intestine. So this valve is really more about controlling access into the cecum, although it looks like there's some division here as well. All right, so let's put this in larger context. So here's the intestines, here is the cecum, and so when I was learning anatomy, this kind of picture was super confusing because this is not the way it looks when you actually open the belly up. This part is correct. So here's the cecum, here's the ascending colon, the transverse colon, and then the descending colon, which comes around. We always think of it being a straight shot out, but in truth, it curves back around and goes out to the rectum. So this is the small intestine, the ileum coming up here. In truth, these are going to be all kind of jumbled up in there. That's going to be, from the cecum, ascending, transverse, that's correct, but the small intestines are like looped around and all over the place. And it's a little bit more organized than that, but this is not an accurate picture. So I think this helps a little, except for that we're missing about 10 or 12 feet of intestine in between this little piece of jejunum, which is so here's the stomach, frame of reference, the pylorus. So we've got a valve here, we have a valve from the stomach up, and so this is sort of reflected out of the body, but here comes the esophagus into the stomach. So again, we've got another valve up there, and then boom, down it comes into the duodenum, and into the jejunum, and off we go. And then, 10 or 12 feet later, we end up back here at the ileum, cecum, large intestine. So I hope that makes a little more sense. The thing, again, I want you to remember is that right here, above the colon, is the urinary bladder. So again, for pets that have had chronic issues with, I'm not even showing this to you. Let me pop back over to the picture. Sorry. So here's the picture laid out a little bit more cleanly. So we're trying to translate from here, which is how it would look spread out on a table, which is absolutely incorrect, into how it might be in the body. And so here's the stomach, and again, this is the stomach sort of reflected up and over the top of the ribs. So again, not a normal position. All this white stuff is the omentum, which covers all of the organs in the abdomen. Here is the esophagus. Here's a valve here. The stomach, the fundus, or the big part of the stomach. The pylorus, another valve. Duodenum, which is the first part of the small intestine, and then comes down into the jejunum, which is the next part of the small intestine. And then, as I said, we got 10 or 12 feet of intestine missing between jejunum and ileum. But for illustration purposes, here it is. So here's the ileum coming up, cecum, large intestine. So ascending, transverse, descending colon. So I hope that makes a little sense. So why am I telling you all of this stuff? Because I am trying to figure out how we could transpose this ileocecal maneuver for pets. And in pets, it's going to be in the lower right quadrant. So again, let me pop back over to this picture because it's the best I could find at the moment. So head's up here, tail's down here, obviously, left side, right side. So I think what may be of assistance is if we apply pressure, if the dog is lying with its left side down, this is going to pop this cecum up, and sometimes you can actually feel gas bubbles. And so my supposition is that if we apply very gentle pressure to the abdomen of the dog, kind of starting towards from the lumbar spine, and let me see if I can find a picture of a dog. So there's a couple of sites about doing massage in the abdomen, but I don't think we've got actual pictures. So let me see if I can find that. But my guess is that if we start towards the spine and gently apply pressure, so I think this actually may be of some help here. So this has the right side of the dog's belly down, and again, my supposition is that if we start with the left side down, and I think this probably is a better picture, and start applying pressure here, and with both hands gently push in this direction, we're going to be over the top of the cecum. Now, I am going to tell you to do this really, really, really gently. And you may, in fact, be able to feel a gas bubble here, because I can tell you that doing this myself was exquisitely painful. So start gently, but I think right here, so here's the spine, the top of the back, you're going to feel muscle till about this level. And then what I would do is, with two hands, kind of one over the top of each other, gently compress over that area and hold. And if your dog is turning around at you and or getting up, you're doing it too hard, do it really, really, really gently. So gently, 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 and hold when you feel some resistance, or if you feel a big gas bubble, or if your pup tells you that it is really uncomfortable, then back off a little bit. And oftentimes just holding that pressure what I was finding myself is that it would release a lot of the spasm that was going on, and all of a sudden the gut would start moving again. So all of this to say, Kate and any of the others of you that we've talked about SIBO being an issue, please try this and let me know how things are going. And I will do a little bit of work and see if I can get Hayo or Mona to be a model for me, so I can show you a little bit better this technique. Now, the other thing is that there is often a motility issue associated with SIBO, meaning that the gut, it's, whether it's from migrating motor complex or whether it's ileocecal valve syndrome or a myriad of other things aren't moving downwards very well. And so what I found myself is that if I ate certain things, it would stop motility right at the stomach. Other types of foods, it would be a couple of hours and the motility would stop in the lower bowel. But it stops nonetheless, and that is really miserable. And the problem is that it sits there and sits there and sits there, and it's uncomfortable. But worse than that, your pet's actually absorbing enterotoxins because it's all sitting there and fermenting, and the bad bugs are getting in control. So I hope that is helpful, Kay. And again, these are many thoughts sort of I'm mulling over, trying to figure out how else we can help these guys. The other thing you can do too is see if you can get like a dilute ginger tea added to the food. So what I would do is start with making a fairly strong tea of ginger root, whether that's dry or fresh, and then add roughly a tablespoon per meal. And the deal with ginger is it does help to improve gastric motility, and so that may be helpful. The other thing you could try, I would start with ginger though, and you can actually get ginger in a capsule. So the human dose for ginger is 1,000 milligrams at bedtime, and so if we parlay that back to a dog, so for a small dog I would say something like something like 250 milligrams of ginger would be a good start. But again, you can just use the real deal. It is spicy, so it can be difficult to get dogs to eat it. The other option would be to put a small amount of dried ginger powder into a treat, wrapped into a treat that if this is the yummy deliciousness and this is the yummy deliciousness and this is the ginger, wrap it in there, a little, pill pocket of a ginger bomb. The other thing that's used commonly in human medicine is iberogast. I did not find this to be helpful, but I will tell you I tried this many years ago. But it is supposed to, again, help drop the drop the intestines, get things to start moving again. So I'll put a link in there for that. I don't think there's anything in here that would create issues for dogs. And yeah, no, everything should be fine there. So that's what I can tell you, Kay. I hope that's helpful, and we'll launch into some other questions, but please try that and let me know what you find. The other thing, and this, I was desperate enough to try it. In humans, there is something called relative energy deficiency -S for sport. And this used to be a problem only in female athletes. But so it turns out that I've been actually under-eating significantly for probably a decade or more. For those of you that don't know, I used to weigh about 80 pounds more than I do now. And so I talked with a nutritionist Thursday, and she said, you got to eat more. And I said, hey, at this point, I'm willing to try anything. And I will tell you that I'm eating all sorts of foods that normally would have not been possible. and trusting that this is the right option. And while it has not been entirely pleasant, it also hasn't been a disaster. And I think that this may be part of the answer for me, because I mean, you know, I over the weekend I had things like ice cream and an almond croissant and, you know, things of that nature. And it wasn't great, but it wasn't horrifying either. And certainly it is not near as miserable as previous to the symptoms and having to restart Cefaxin. So I hope that's helpful. Now let's see. Kathy is asking about Daisy and Dottie on their elimination diet and off of all of these things, and sort of what toothpaste do you recommend? What I would suggest doing, Kathy, is trying, and this will sound weird, but trying bentonite clay in a little bit of coconut oil, or another type of oil that they can tolerate. I can't remember if that's on the list or off. But I would try that, and then just literally put some on your finger, inside the mouth, brush, 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 brush. So the bentonite clay is not harmful if they swallow it, and the coconut oil they generally like. So hopefully that will help you. And then in some good news for Mr. Willie, and this is really bizarre, Jamie, but I think you have the right person. So the further pathology came back saying disseminated histiocytic sarcoma, and your oncology vet says he questions this diagnosis, and I would have to agree with you, especially if the ultrasound is clear, which is the case, and hurrah, because this disease is like usually within 2 weeks of diagnosis, this pet is dead, and it disseminates, so it just doesn't make sense. And I think sending the sample to another lab is great, but the treatment is similar, so that's interesting. So non-malignant histiocytosis, so is hopefully the thing that actually is. And here's what I would do. Take a deep breath. And while I would use, so what Jamie's asking about is, you know, what kept it at bay, or did it morph into cancer, or is the pathology just flat wrong? It under wraps. And I would have to say that if it is, there is nothing visible and in the spleen and liver, that there is a different diagnosis here. And did the Apoquel cause it? Maybe. It could be. It could be just a myriad of things, because Willie has had a lot of problems. And unfortunately, long-term inflammation does some weird stuff. So the ozone topical ozone oil was helping, and he decided to treat now, which is great. So he had a dose of CCNU Friday and did start steroids, and things are like a lot better, which is great. And this is the thing. I mean, steroids are here for a reason. It's horrible when you have to be on them for the rest of your life, but when you need them, you need them. And so if this has provided comfort and he's able to relax and he's not destroying himself, I think it's great. So what I would say is take a deep breath. And do what he asks. So you can stop the CBD and the CBD with THC. I don't think they'll have that much effect on the liver, but this is also a way for you to be clear about what is or is not helping. And he is on Denamarin. I would suggest adding in some regular milk thistle too, because I feel it works better than Denamarin. And give him the 3 weeks. And yeah, I know, Jamie, you must be ecstatic about the ultrasound. And then the other issue with the TCM herbs, I think it's reasonable to stop them. And so then I think now you figure out, okay, what's working. And the other thing is he's on so much stuff. I mean, this guy looks so much better. That is so awesome to see. He is on so much stuff. It's hard to know what's helping and what's not helping. So this is an opportunity to kind of clear the decks, let the heavy duty, let the sledgehammer do its work, and then start adding things back in one by one, and they must earn their place back in his regimen. So I'm not sure what the long-term strategy will be, and I think a lot of that is dependent on the next chunk of pathology that gets done, so you can figure out what's actually going on there. But I mean, this guy looks 1,000 times better. Looks like he feels better. He's playing. Jamie said they were working out last night, and boom, he's in the. One of them had to do. It sounds like your rest in between sets is to keep him occupied, which is marvelous. It sounds like he feels so much better. So congratulations. I am so delighted you're getting somewhere. But as I said, this is an opportunity to reset and find what has value specifically, and add things back in one at a time. And I can help with that. Dr. Lisa can help with that, and then we'll go from there. So I think that's it. How do dogs get vitamin D3 in their diets? So Bettina, this is, let me see if I can remember it. I'm sorry, I'm a little shy on brain power today. Dogs, I believe, can actually make vitamin D3. And this is the frustrating part, because we don't know what too little is, but we know what too much is for dogs. And so they have to, yeah, that's right. They don't get it from the plant, so they have to consume it. So this is where it gets a little frustrating. So we know, again, what too little is, but we know what too much is, and we're not quite sure what too little is. So this is the problem. Many of the pet food recalls have been due to excess amounts of vitamin D3, or yeah, Jamie, that's the downside of prednisone, is he's ravenous. And actually his body actually may be ravenous, because it's been, starved with all of the distress he's had. So this is the problem. Generally, we have some clue about what the vitamin D dose should be, and that is indeed why there is some Mary tested low. Yeah. So this is where it's kind of tough. So this is where you have to really give a little bit. So but I think you have to go very carefully. You can use a liquid type vitamin D and use, because it comes in at 1,000 IU per drop. Let me see if I can find that. Product for you. So Now Foods has one, but this is where you want to go very, very carefully, because, again, calcitriol, which is a form of vitamin D3, has been one of the big issues in. Let's see what this one is. Yeah. So let's see here. Let me pop over here. So one drop gives you about 1,000 IU, and this is a now product. There's a ton of them out there, and this is interesting that it's derived from lanolin. So you can certainly add it into dogs, but I would do it with caution. And this is a problem, is we're just now starting to see what dogs do and don't need for vitamin D. So it's another topic I need to revisit, because I think finally there is some research starting to come out on it. So I would look at that, but generally it's all from the diet, because they can't make it on their skin, so they must ingest it. And Sri is asking about CC straining. And she's doing this on whether she has hard or soft stools, and if she's on a commercial or a crock pet diet, and what is that about? So she strains and strains, and then finally passes a stool on the 4th or 5th time. So, Sri, what I would suggest doing, if the stools look flat or like a ribbon structure, if they're not coming out normally, I would ask your veterinarian to take a look, make sure that A, she doesn't have anal gland impactions, and that's part of it. B, that there's not something in the area of the rectum that's creating a problem, like a tumor or lymph nodes inflamed, something of that nature. You're welcome, Bettina. And see if that is, if either of those things are going on. Let's make sure first there is not a structural issue. And if she is bouncing between soft and hard stools, I am wondering again if she has a motility issue, like she can feel that it is there, but she's not able to get it out. So again, she may be a candidate for trying this abdominal massage to see if we can get things moving from the ileocecal valve, both forwards and backwards. And then the other thing you can do is, if you know pretty close in time where her, how close to eating she goes out to pass a stool or vice versa, you can take an ice cube and kind of rub it around the edge of her rectum, and that will often stimulate the colon to know that, ooh, I need to get rid of the stuff that's in there. So I would try those things first, actually, because if she's going between hard and soft stools, and I'm not clear if you've got a, true constipation issue, or if it's just one day she didn't drink enough water. But try those two things. First, make sure it's not a functional problem, and then if it is not, then try the stimulation of the rectum, and then also massaging the ileocecal valve. And Lolly's saying something about the mention of coconut oil. She stopped using it when her pups got sick with pancreatitis. And I'm not sure where that is. Let's see. So, and this is the thing. Oh, okay, so it's a length from dogs naturally. So, Lolly, this is the other thing. These folks have provided a terrific amount of information over the years, and some of it good and some of it not so good. Here is what you want to remember. This is a supplement sales site, and they are going through things that sometimes are based in science and sometimes not. So apples, bananas, berries, blueberries, cranberries, raspberries, strawberries, cantaloupe, cucumbers, oranges, and other citrus fruits. So here's all the things that are okay, how to share it, and fruits that are bad. Avocados, and actually the problem is not in the fruit itself, but it's in the pit. And so a small amount is okay. Coconut, so this is the explanation about why this should be a problem. So and grapes and raisins and yada, yada, yada. So here's the thing, is that all of this, again, is dose dependent. So we could also have a problem with this compound called persin, but the volume that we would have to eat is tremendous. Same thing with coconut or coconut oil. If we eat tons and tons of it all the time to the exclusion of everything else, it can be a problem. Same thing with grapes, same thing with chocolates. If you feed a ton of it, it's a massive problem. If you feed a little bit, it's okay. So this never feed grapes, I mean, we've all fed our dogs grapes for years, but we don't feed them a kilo at a whack. Again, this was, this is a site that likes to educate through fear too. And I think you have to take everything with a grain of salt, but too much coconut oil can be a massive problem as far as for dogs that are sensitive to coconut oil. But does it mean you should never use it? No, but you should limit it, pretty markedly for dogs that have had issues with pancreatitis. So I hope that is helpful. Bettina was asking for the replay from January 26th, and I think Hannah got that posted up there for you. So here it is on YouTube, and you can hit that YouTube link. We'll also get this posted up in the members site as well. So I hope that makes sense and hope that was useful. On the member site, she'll also include the PDF download and a couple of other things. So she's got that work in progress. We should have that up in the next day or so. But in the meantime, you can go to the link and check it out. So y'all, if this was useful and you are not iPet'sAlly Ultimate members, check it out. Consider upgrading, because my goal is to start doing topics like this more frequently. As I learn more things, then I'll be able to pass those on. So that's what I have for you today. Any other questions you can think of? And if not, until next week, in your pets, and give them all a big hug for me. Many thanks.